Hello, we are live. This is Jamila Tucker from Easy Peasy, Left P of Easy Peasy. It's 12 o'clock noon Eastern Standard Time. We're on the East Coast. I am trying something new, something different than the way we did it last week. I'm doing a different type of screen share. So the last time I shared slides and then we kind of transferred over to a little FaceTime chat where we continued to do a couple additional questions and we basically just did a sign off. So this time I'm doing a full screen share, so I'm hoping that way I can kind of toggle back and forth between some slides and you can probably see right now I have a little video playing from the spinoff.co.nz that's out of New Zealand. And I really like this graphic. This will probably be our background graphic for today because it shows what happens when you have a virus that's contagious. In this particular example, you can see that first node then spreads to 3, and those next 3 people, a couple of them spread to 2, one of them spreads to 2 people, and the other 2 spread to 3. So this is how a lot of virus transmission occurs across populations, especially for droplet type contagious ones. Ones that are highly airborne contagious, like measles, for example, that those nodes are much greater in number. They're much more contagious. And so this exponential spread gets much bigger, much faster. The second thing I like about this video is that it talks about why social distancing works in pandemics. And part of that is when people stay home, you can see, let's say the first example, that little arrow that says this person worked from home. So that person, instead of kind of continuing on their node of spread, the spread stopped with them. So they stayed at home with their virus as opposed to taking it out to that barbecue or the airport or the gym, for example. So I like this video, and we will definitely come back to that. So let me see. Now I'm gonna, again, this is something different. I'm gonna go to, here we are. Oh, my cousin's here. Hello. Okay, so this is something new. So I'm sorry because now it looks like we're looking into an infinite number of Facebooks. This is something I haven't done before. Hopefully the audio isn't weird. But what I'll do is I'll kind of toggle back and forth between these questions and that video and then our slides. So last week we did a lot of these same slides, so I'm gonna not really go over them in detail again, but we'll talk about some new stuff as well. But let's just do a quick summary again. So why this coronavirus is a big deal. It's new. So this is a new virus. Everyone around the world is seeing it for the first time. You have to spend time when you are exposed to a new virus. It takes your body a couple of weeks to mount an appropriate response. And during that couple of weeks, you might have very mild symptoms, you might have no symptoms at all, but you will be contagious. And because that period of time when your body has the infection before you've cleared the infection is quite long for viruses that you, or bacteria for that matter, but for viruses in this example that you haven't seen before, there's a longer contagious period. Again, the good news for most people is that most people will not have severe symptoms. Most people will have mild or no symptoms. That's good for us as individuals. It makes it hard to control the virus in that way because when people have mild or no symptoms, they go about their business feeling great, going to work, going to the gym, sharing their virus with lots of friends and family. So that's the challenge with this virus, is that there's a couple of weeks, we think, for most people before you're clear from the infection, but during that period of time when you're feeling great and your body is working on fighting the infection, you are contagious to other people. So that's pretty much what this slide is about. So again, we kind of summarized this in the first slide. You can be infected and not know it. And my little caveat here is don't panic, because if you have a very mild infection, this is probably most likely not going to be a problem for your own health. The challenge becomes that you can spread the infection to people when you don't know that you have the infection, like a lot of viruses. And this can be a big problem for other people. I'm sorry that these are timed, and I didn't really want the timer to go like that. So if you can stay out of the public for the next few weeks, and not everyone's job is amenable to that, but if you can, definitely do it. And if you are still going to work, even when you're not working, still try to socially distance. So that means limiting your trips to the grocery store, limiting your trips to the post office. In most places these days, most of our public spaces, such as the gym and coffee shops and restaurants, are generally closed for sitting in. You can take out from those places, but even if you do have to go to work in your downtime, try to socially distance. And then, of course, if you can't stay home, be extra cautious about leaving germs around and bringing germs home. So that means, the elbow sneeze when you're going out, so not trying to get contagion on your hands, and then washing your hands, of course, before you are doing anything where you're going to touch your eyes, your nose, and your mouth, which I like to call the infection portals. So that's how infections get from outside the body to inside your body. Most likely infections like this, they have to touch your mucosal surfaces. So that's kind of like your soft, mushy, the pink surfaces. So the eyelids and your nose and your mouth. That's how most of these types of infections will get from the outside of your body to the inside. So your hands are the vector in a sense, and then your hands are touching your mucous membrane. So try not to do that. So this is a little slide similar to that video that we were just showing, talking about why your contact with other people matters. And I wrote on here in particular, no exceptions, because this is a natural thing that we do as humans. We always find reasons why the rules don't apply to us. So you might say, I actually picked sneezy smiley faces for this graphic, but again, many people that might get exposed to this infection will have mild to no symptoms. So it's hard to know if you're in that category. And so my advice is to consider yourself to be contagious. And if you think of yourself as someone who is contagious and potentially harmful to other people, you will limit your contact with others. So for someone that does have this particular infection, we think that in epidemiology, it's called the R naught, but it's basically how infectious this virus is. They think for this virus, it's somewhere between 2 to 3, for example, so that every infected person will spread the virus to 2 to 3 other people. Just because I'm doing like a 2.5 sneezy face was kind of hard, I picked 3. So we can basically just talk about this one person spreading to 3 people, and those 3 people spreading to 3 more people, and those 9 people spreading to 27. And then I ran out of space on the graphic. So the other graphic I think is much more helpful in terms of being able to see, how these things move through populations. There's another little graphic here too, for all of my teachers that are listening, and the students as well. When your teacher was trying to explain to you the difference between exponents and regular multiplication. So this is an exponential type of spread, not a linear multiplier. So for example, here on day 1, I just kind of use, because any number to the 0 exponent is 1. So that's your 1 person initially that's infected. And then that person can spread. I just kind of made an every 3-day estimate here, but that contagion period can happen for the first week at least of your own personal infection. And then those people are also contagious during that period of time. So that person spreads to 3 people. So now you have 3 to the first power, right? That's not, that's 3. So now you have 4 people who are sick at the same time. And then each of these 3 people are spreading to 3 people. So again, this is not, your teacher will get you if you say 3 to the power of 2 is 6. It's not, it is 9. So those 3 people haven't spread to 6 people, they've spread to 9 people. And so now we have these 9 people, plus remember these 4 people back here are still sick from before, because this is, we think most people takes a couple weeks before they clear this infection. So now you went from having 1 patient to these new 9 people plus those other 4 people. So now you got 13 patients a week later. And then 3 days after that, you are at 3 to the power of 3. So again, your teacher will be mad with you if you say that's 9. And it's in fact not 9, it is 27. So those 9 people did not give the infection to just another 9 people, they spread it to 27 other people. And here we are again on day 10. All these people are still sick, remember, because this is the first time we've seen this infection. It's going to take the body a while to make antibodies and clear the infection. So aside from just these new 27 people that are sick, you have to also count all these people back here that are, they're still sick as well. So now you got 40 patients. Or they might not be patients, maybe they're at home sick. They don't necessarily have to be my patients in the hospital necessarily, but they are sick and they are contagious. And then I gave you some more, exponents to play around with here: 3 to the 4th, 3 to the 5th, 3 to the 6th. But remember, it's not just 3 to the 4th would be your next option and that would be 81. So it's not just those 81 people, because it's a lot of these people in the earlier part of the week are still sick. So it's 81, and then I just went ahead and added your 40 patients from before. So now you have 121 patients, and it continues. So, be mindful of that. It's hard because even when you're feeling great, it's hard to limit yourself. We talked about this in the last presentation that people that feel great, you don't generally, people that feel very sick, you don't generally have to tell them to stay home because they don't feel great. So they're going to kind of stay home, and they might be one of these people down here who says, I'm not going to spread to 3 people because guess what? I'm staying at home. So it's really the people with mild to no symptoms for this infection that we think are the challenge. And because not everyone is going to get tested, so you might not know that you are potentially infected, the best suggestion is to act as if you were and try to be home as much as possible. So this is going back to this little slide again. The link, when you guys are on the Facebook page and see the video, the stored video of this presentation, that link will link to this video. So again, this example uses basically a 2 to 3 person contagion spread. So again, this one person spread to 3 people, this one person potentially spread to 2, this one spread to 3, that one spread to 3. But if you can create an intervention so that someone's working from home, someone didn't go to that cookout. I think the bottom one was someone didn't travel domestically on an airplane, and someone else stayed home, you can decrease that spread pretty dramatically. There's a group of doctors that a lot of us doctors are sharing information on our patient care and experiences in the office. And one of the things that we're, again, emphasizing not just to the families that we take care of, but also to each other, is that, remember, before we understood germs, before we had germ theory, and before we understood viruses and bacteria, people did understand that there were some things that could spread from person to person. So in modern medicine, social distancing sometimes seems pedestrian. It seems silly because, in this day and age, we have so many medications that can fix so many things. Um, but social distancing is the way that before people even understood what germs were, they did understand that whatever I have could become your problem as well. But if I stay over here and you stay over there, it might not be a problem. So this is how we handled previous pandemics, the 1918 flu, for example. If you guys have read anything about that epidemic and pandemic, actually, there's stories out of Philadelphia that had a huge parade in the fall of that year, and St. Louis. In contrast to that, around the same time that they had their first case, they started mandating social isolation. They didn't call it that at that time, but they basically told people to stay home. They closed the restaurants and bars. Um, and the epidemics looked very different in Philadelphia versus St. Louis. So, again, even before we understood really what germs were, people did understand that um, things can pass from person to person. And if you keep your distance, you can decrease the likelihood that that spread happens. And again, that's what this video shows. All right, boom. Let's go back into this. Sorry about that. I thought it was going to just jump in. So this slide, again, flattening the curve. So this is kind of what we were talking about before. It seems silly, social distancing, but it's not. And this has been shown in other pandemics that it works. Viruses can't move without us. So if we stay put, the virus stays put. The challenge for us is that if everyone gets sick at the same time, we won't have enough doctors, nurses, and hospital beds to care for those who need medical attention. And that's even including non-coronavirus reasons to need the hospital, such as trauma, having a baby, heart attack, etc. So for your own job, think about what it would be like if everybody called out on the same day, for example. So everyone calling out on the same day could be a challenge. I'm sorry, I'm just realizing that you guys probably can't see that last line, but that's fine. We'll go on to this one. So flattening the curve. So what we're trying to do is basically, in this example, this is kind of like everybody being sick at the same time. That's bad. Huh. And say, like, for example, in the example of your own job, this is like everybody calling out sick on the same day. That's, nothing's going to happen. That's, you know, nobody is getting called back. If you're in sales, nobody is doing sales. And if you work in the hospital, that's nobody's available to take care of you. Or in the hospital capacity sense, there's too many people already in the hospital. And there's no space for you. So what flattening the curve is giving us an opportunity to not have everybody get sick at the same time, but to let people carry on separate trajectories. It's kind of the opposite of the chickenpox party, if any of you are old enough to remember that. So once upon a time, for kids that got vaccinated for varicella, this doesn't happen anymore. But in families, the chickenpox is highly contagious. So this is a virus that's not similar to coronavirus. Varicella has an airborne spread. So basically, once one kid in the house has it, pretty much everybody in the house was going to get exposed to it. What families figured out is that it was very hard to have the kids sick and stay home from school at different times. So they decided they wanted everyone to get sick at the same time. So they'd say, hey, my kid has chickenpox. You guys need chickenpox? Come on over, have a sleepover. We'll all get chickenpox at the same time. So that way, one of the parents can stay home with the kids at the same time, and the kids aren't on a staggered curve. So this is actually the complete opposite of what we're trying to do here. We're trying to stagger the curve so that not everyone is sick at the same time. So when everyone is sick at the same time, that in this setting, because this is a disease that a lot of people will need the hospital setting for, and they'll need ICU even, which is an even higher level of care and equipment and expertise that's needed to manage those patients. We don't want all of those patients to be sick at the same time, because the resources, this is my little dashed line here, the resources that we have to take care of those patients is small, it's limited. So in summary, viruses can only get around if we help them. If you don't go anywhere, the virus doesn't go anywhere. So if you can, please stay home. And if you can't stay home, think of yourself as someone who could be harmful and contagious to other people, even if you're not feeling sick. So touch as little as possible when you're in public. Take as little out and bring as little back. So that means frequent hand washing, wiping surfaces that you're touching when you're in public, wiping your own surfaces. We call them high touch surfaces. Those are surfaces in your household that the whole family is touching. So try to wipe down those surfaces as much as possible. And I know that a tiny little invisible enemy like a virus can seem imaginary and silly. So this is when you have to trust your scientists and doctors, epidemiologists who study this day in and day out. Make sure you're keeping up with recommendations from your local officials as well, and don't forget to check on your neighbors. All right, so that's our slides. So I'm going to go back to my new favorite slide, the stay home slide. Let's see if I can get back on to this Facebook thing too. Oh my word. Oh, questions. Hello. So I'm going to scroll down so you guys can probably see me looking at your questions here. So I'm going to go through your questions and I'm going to mark them as I reply to them. And here is Stephanie Washington. Thank you. Hi. Why don't they do a total quarantine for 1 or 2 weeks so it would stop the spread? I think that's a good idea. I can't say why they would not. I think that here, so this is just so you guys know, Stephanie is a family member and they are in Germany right now. So different maybe to health systems in other countries, our health system functions essentially as every state has their own health system and makes their own rules. So every state is kind of managing the epidemic on a state by state level. It's a challenge, of course, because we travel a lot. People travel from state to state. The virus doesn't know that this is Delaware and this is Maryland. So coordinated responses I think would be best. But yes, basically, the more we stay home and the more we keep our germs to ourselves, the faster this will go away. So I appreciate that question, and I think we should. And again, even in your particular area, this is not applying to necessarily to Stephanie, but even in your area here in the States, if you don't have an official stay-at-home order, if you can, stay at home. If you guys haven't started talking about it at your workplace, maybe bring it up with your boss. If you have the kind of job where you have the option of teleworking, definitely do it. Do your part, even if it hasn't been a national or a statewide order yet, a local order to do that. I think that's a great idea. And then, I love this question, a vitamin for kids to boost their immune system. So I think kids taking a multivitamin is fine. Stephanie and Phil know that, Doriel and I, my sister and I, the P's of Easy Peasy, love talking about general good nutrition altogether. So we recommend that kids get a variety of foods in their diet, of course. Work with your pediatrician to make sure your kids are on the growth chart, growing and developing. That's really the best that you can do. Make sure they're eating a variety of foods, eating the right foods, growing and developing, and that will keep their immune system strong. I don't have any particular vitamins that I recommend that are specifically for the immune system, but I would put that under the category of general health and just kind of staying healthy and well, and for kids making sure they're growing well. And I think a multivitamin is a reasonable addition to that as well. So thank you for that question as well. I didn't want to like it, I wanted to love it. Let me see if I can fix that. Boom. Okay. Hopefully this is working for you guys. Nobody's texted me yet to say this is too annoying. Oh, wait, maybe somebody did. Oh, just kidding. Okay, here we go. All right, here we go. Another question from our DM. We have, what symptoms should we look out for in kids, and at what point should we take them to the doctor or hospital if necessary? Excellent question, and I will go ahead. I'm a pediatrician, but I will go ahead and expand these recommendations to adults as well. So it's really for this particular virus, what we think the major complications are in the respiratory system. So that means, not just kind of upper respiratory symptoms, which we think of as kind of the runny cough, mild cough, and runny nose symptoms, but the symptoms that are going to get people in trouble will be the lower respiratory symptoms. Sorry, I'm just going to go back to my little thing here again. I love this slide. So when people are having lower respiratory symptoms, to the point where they need to go to at least call their pediatrician or their general practitioner if they're adults, and maybe go to the doctor, is if you're having pain when you're breathing in, so difficulty taking deep breaths, pain when you're taking deep breaths. You also know when your lower lung function is being limited, if it limits your activity. So let's say if you're following your stay-at-home order and you're mostly around the house and you get winded walking from your bedroom to the fridge, or walking to the bathroom, doing very limited activity and things that would normally not give you a problem, that might be evidence that you have a lower lung problem that requires the attention of your doctor or even your emergency department. Kids are a little bit different. Those of you, there's several of you that are on this chat right now that I know have kids at home. A lot of times kids just, they have so much energy and they generally do so much all day long. When kids are sick, they generally tend to just not move or sleep. And I don't mean not move in terms of that you can't wake them up. I mean in terms of what kids usually do when they get up in the morning is play. And remember, play is the work of children. That's not to diminish that. That's how they learn, and that's how they apply the skills that they're learning is through play. But when kids don't want to play, you know that something's going on. And again, when kids are kind of down and out, they tend to sleep a lot. So those symptoms, I think, should be your initial things to kind of perk your ears up, and then watching how your child is breathing. So kids generally breathe pretty comfortably. If you guys have ever seen your kids with challenging breathing, sometimes you can see their clavicles. So that's your collarbone. When they're taking deep breaths, you might kind of see a little depression there. If there's little babies, sometimes if you look at their lower ribs around their stomach area, you can see that they're taking really deep breaths, because you can kind of count the ribs going down. You don't usually see that, but when you look at their chest, you can see that they're working hard to breathe. So those would be things that I would definitely call the pediatrician for. And if you're worried, I say trust your instincts. And if you think your kid's really in trouble, then take them to the emergency department. Remember that for the next few weeks, if not months, while we're fighting with this pandemic, the emergency departments are going to be full of people with coronavirus and other emergencies as well. So make sure when you're going there that you definitely need to go. You definitely don't want to, this is not the time to go to the ER for a tummy ache, for example, or something mild. If it's something that you think you can manage with your pediatrician or your general practitioner over the phone, over a FaceTime visit, if as much as you can stay home from urgent care in the ER, that would be the right thing to do. Awesome. All right, let me see. I think I don't have any other questions here, but we got some questions from last week that I'm going to go through again. And I'm going to see, okay, now don't forgive me if this chat goes off. I'm going to press this stop sharing button, because I think you guys might be tired of looking into this infinite stream of Facebooks. I am. So I'm going to try to stop sharing this and then see if it goes back to my camera. If it hangs up this video, I will restart another video and do some additional questions.